Hi, it's Kathy Kress again, and I am back with my YouTube channel on geriatric care management, and we are doing nonprofits. Should they add geriatric care management as a new service, an income stream to their nonprofit service? And we've been doing feasibility study because many nonprofits who did this a long time ago did not figure out should they do it. What were the factors that would tell them to do it or not do it? And that's what a feasibility study will do for you. So we just covered a competition survey, basically who's your competition. And now we're going to do another part of a feasibility study and a marketing study, which is, do you have the referral base to get customers? Because the whole idea is to render really good services, but to have access to customers who will buy your services, and you get a lot of them from third parties. And so you got to figure out, are those third parties in the county that you chose, or the borough that you chose, or the area you chose to start? And what's a third party source? It's any group along the spectrum of care, because older people, as they age, engage all sorts of professionals along the spectrum of care to help them age, both money-wise and health-wise. And so you want to find out, are these professionals there? And that will refer to your geriatric care management agency within your nonprofit. And again, you're finding market share. That's what you want to find. Should you start that? Do you have market share? And you want to find an area, is the county that you chose, and you can choose the county by doing this. What county has the highest volume of third-party referrals? So again, you design a survey. And who are these third parties? Well, first of all, they're healthcare professionals. And it can be private duty home care agencies. And that's different than a Medicare-based agency. Medicare-based home health agency is paid by Medicare. But the people that really take care of you when you get out of the hospital and ongoing are private duty, because Medicare does not pay for that at all. It's an insurance program. So you look at private pay home care agencies in your area, because they will refer to you if they aren't actually pretending to be a geriatric care management agency. You look for the number of hospitals, because hospital discharge planners will refer to your geriatric care management agency. You look for physicians. Physicians are learning more and more via Medicare, by Medicare penalizing hospitals that have people come back within 30 days, older people. Physicians are learning that they need geriatric care managers as well. And then hospice, because hospice isn't, it's a healthcare agency, but it isn't necessarily just for the dying anymore. It is for people who may be in a possible dying process, but their clients go in and out. So hospice is a good referral source, a third party. And then rehab facilities, because people go in the hospital and they don't necessarily come home right away. They'll go to a rehab facility and then go home. And the rehab facility will refer to your geriatric care management agency. So you look at all these referral sources within healthcare and figure out how many of them are in the county and would refer to you. And you may have your own hospice. Lots of nonprofits have this. You may have your own rehab. You may have your own hospital, I don't know. And that would be a great reason to start geriatric care management. So we will continue to look at external referral base. And I'll see you next time. And always go to my website, kathykress.com.